Pain in the upper chest and armpits area after breast augmentation. Let's talk about that. That's not really talked about very often. That sort of pain in this area and after having a breast implant. You're really only going to experience that if the implant is placed underneath the muscle. The muscle we're talking about is the pectoralis major muscle. That's the largest muscle of your chest, attaches to your sternum in the middle, to your clavicle over here, that's your collarbone, attaches to the abdominal wall down here, and then that muscle actually goes all the way over to the arm, and it's what creates this bulge here. That's my pectoralis major muscle. So if the implant goes under the muscle, remember that's one of the locations we use probably most commonly really, that it goes under the muscle, that will lift that muscle up ever so slightly, and that changes how that muscle interacts with the shoulder and the arm and the chest, and that can make patients feel uncomfortable. It's not really a pain like a stabbing type pain after surgery, but patients certainly have mentioned to me many, many times, yeah, I have some pain over here. I don't know why I have pain over here because I have a breast augmentation, but that's why, because the implant goes underneath, tense the muscle up a little bit, and it feels a little bit weird. That goes away usually after a few days or a week. I think the swelling kind of goes down a little bit too, and that muscle gets used to that new location and it functions fine and it doesn't give patients any problems long term. But if you have that in the short term after breast augmentation, it's most likely because the implant is underneath the muscle and it will go away with no other treatment or anything else. Just gentle movement can help it though, help you kind of get used to that after surgery. Remember, we don't want you walking around like this after your breast augmentation. We don't want you doing any of that. We certainly don't want you doing any of this type of thing like the dad jokes, you know, don't do any of that. But we want you just to move gentle and use your arms, use your shoulders in a normal way, and that will help you get rid of that discomfort that you have from elevation of the pec muscle from your implant.